We just knew that whatever you call it, if you want to use the negatives or call it Obamacare or any kind of care you want to, it won't work. It can't work because all you have to do is use common sense. You have this imploding of people. You have diabetes. You have one person in America weighs more than the other two. You got guys who choose to do tobacco, who choose to do booze, who choose to do designer drugs, and all of them will be taken care of. You've got pre-existing conditions in 3-year-olds. What happens through their 60 years or 50 years of life? All you have to do is forget the charts and know that if you torture statistics long enough, they will eventually confess. And know that this country cannot exist on any kind of situation where a guy who could buy this building gets a $150,000 heart operation and doesn't even get a bill. Now that's nuts, and that's where we are in America. There's no affluence testing. You got to raise co-pays. You got to knock down providers. You got to deal with physicians. You got to have hospitals keep one set of books instead of two. That would be a start.
Senator Kerry, I have a lot of opinions about health care. I think the current system doesn't make any sense to pay twice as much as any other developed country for health care and have our results ranked somewhere between 25th and 50th. To have, we got 50 million roughly people who don't have health care insurance. I just ran the public health care system in North Carolina. It reports to the president of the university. And if you don't think those 50 million people get health care, you're crazy. They get health care. They just get it to the emergency room at 5 to 7 times the cost it'd be in the doctor's office. And that cost doesn't disappear. It just gets cost shifted to those of us who have health care insurance and in the form of higher taxes. We have got to have real structural reform in health care. I believe all people ought to have health care, but I don't think anybody should get on the government's checkbook or the taxpayer's checkbook or a Cadillac plan. I don't think anybody ought to get first dollar coverage because I think that we ought to make sure that people have skin in the game. And if you're going to have everybody have coverage, then you got to have everybody have a medical home. And if everybody's going to have a medical home, then you darn well got to make sure that education institutions like mine are producing more primary care doctors and more nurse practitioners and more physician's assistants and not so many specialists. I think if you want everybody to have prescription drugs, then I don't know why in the world you wouldn't have Medicare negotiate with the drug companies for prescription drugs if the taxpayers are going to pay for them. And I don't know why anybody who was getting drugs from the taxpayers ought not to have generic drugs. If you don't think that hospitals and doctors practice defensive medicine, you're absolutely crazy if they do. So we got to have some kind of real tort reform. And you're absolutely right. We got to go to paying for quality, not quantity. And at the end of the day, nobody likes this, but without talking about death panels and that kind of crazy stuff, you're going to have to do something about the end-of-life scenario. Those kinds of things have to be done if you're really going to address health care.